So it's my first day of orientation. I'm actually the first one here. I came a little bit early because I wasn't sure how long it would take me to get here from Coral Springs. So it took about an hour, but I did leave at prime time traffic just because I had to be here for 10. So I would probably be leaving a little bit earlier so I can cut that time down to probably about 40 minutes, but we'll see how today goes. What's up, YouTube? I'm Cody. I'm a third-year medical student. Welcome back to my channel. So in this week's vlog, I want to take you guys into, I guess, a couple weeks of my psychiatric clinical clerkships. It was pretty interesting. I really enjoyed it. So take a look. So out here in the outpatient setting, got my iPad, getting ready to see a couple patients, so it should be cool. So yeah, I saw a lot of patients today. I lost count really, but I had to work an extra 45 minutes because the clinic was so packed. I think we had about 106 patients, and so we only have 7 students. And so each student has to screen patients, and so 106 divided by 7, you do the math. So it's been a pretty hectic day, but it's been cool. It goes by pretty quickly. And we had some drug reps that brought us some lunch, so that was a plus.
Work at. We don't work out here, there's no gym.
Alright, so it's Friday, last day of the week. I'm happy and excited about that. But yeah, so how I typically start my morning, I listen to a podcast called Psyched. And basically it's a podcast about different psychological illnesses and the student, well, they're residents, and they bring in board certified psychiatrists. Interview them about things like, so they may have an episode on generalized anxiety disorder or major depressive disorder or schizophrenia. They'll have an initial episode on that, and then the following episode will be how to treat that. So treated with different drugs, maybe cognitive behavioral therapy or ECT. And so that's a pretty cool way to start the morning. It takes me about an hour to get to work in the morning. So that podcast typically lasts between 40 minutes to an hour. So it pretty much takes up most of the time and allows me to kind of keep my mind away from the long drive. But yeah, so I just got to Campus Health. I'm gonna go upstairs, check in, log my iPad out, and finish up this week.
Started thinking, okay, what else must be happening on a longer scale? And that is plasticity. The brain is trapped in G0, right? If it dies, it can't regenerate. But neurons that are stimulated are more likely to increase.
All right, so right now I'm gonna head to the library and do an NBME. Yeah, I haven't been able to vlog as much as I wanted to because I've been kind of a bit busy. But yeah, Saturday morning, I take my self-exam in about, like 6-7 days, and I have about 3 more days of my psychiatry clerkship. So I'm gonna update you guys on that. I think this test should take about 2 to 3 hours, so I should be done pretty soon. Come back home, finish studying, and yeah. So right now I'm going into my 6th week of my rotation, so I only have a couple more days. And then this Thursday I take my shelf exam. So with shelf exams, you take them at the end of each rotation. So psychiatry, I'm taking the psychiatry shelf on Thursday. Next rotation is surgery. After 3 months, I'll take that shelf, and so on. And pretty much it covers all the high yield materials, about like a 3-hour test. I think it's like 110 questions, and it covers that high yield material, like I said, and it counts for like 33-35% of our grade. Looking forward to taking this test. I did pretty well on my NBME and my UWorld questions and all that. Also, I'm going to put what I used to study for shelf exams in another video, as well as USMLE Step 1, so stay tuned for that. But yeah, so with this psych rotation, I did an outpatient setting and an inpatient setting. So with the outpatient setting, we saw about anywhere, so a low day would be like 60 patients and a high day would be 140 patients, split between about 5 to 8 students. We'd go in, screen them, ask them all their past medical history, past psychiatric history, current medications, all the medications that they've been prescribed, how they've been doing with their current regimen, if they need to change anything, any adverse side effects, anything like that. And we get all the information, and then we go and present to our attending physician. Attending physician may ask us a couple questions about what's going on, what do you think we should do with the medications, yeah, just basic things that you would be expected to know as a third-year medical student. And then we go in with the physician. They kind of brief them on what's going on, if they're going to continue the medication. It's quick and easy. But sometimes if you have new patients, we got to get a full kind of story and history. And so the physician is spending a little bit more time trying to gauge and kind of trying to figure out what exactly is going on with the patient and what would be the appropriate course of treatment. So that's how outpatient works. And I would work from about 9 a.m. to 5 p.m. and we would get lunch sometimes. It was good from the drug reps. Hey, shout out to the drug reps and their lunches. But inpatient is a little bit different. The hours are definitely better. I would go in at 8 o'clock in the morning and I'd be done no later than 1 o'clock. The earliest I got out was like 9:30. And that's because we had to take a patient to court and the judge had to rule them competent. That's something you'll learn as you go and progress in medical school. But anyway, with inpatient, you go in 8 o'clock. If there's a new patient there, you interview the patient. And the way this inpatient worked was pretty different from outpatient. Like the history didn't have to be as extensive because this is you come in and we kind of get you together and stabilize you and then kind of ship you over because it's a crisis unit. So we'll go in, get a patient, we'll do rounds with the attending physician. That'll take about an hour, hour and a half, and then we'll go back to his office, talk about psych, different diagnoses, different medications, different treatments, all of that. We'll talk for another hour. And then we just go home and study for the shelf. So yeah, not 8 to, I would say on average about 8 to 11:30, 8 to 12. And then the rest of the day is spent working out, studying, getting in some naps. But yeah, I won't have that luxury next rotation because I start surgery and that's gonna be something else. But whatever. But yeah, I like psych. Psych is cool. Before I actually started this rotation, I was like, man, hell no, I'm not doing no psych, man, that's crazy. But now that I've done the rotation, I would actually consider doing psychiatry. It's pretty cool. You have a nice lifestyle, it's laid back. You have a life outside of medicine. The hours are great, depending on what you want to do. The residency is kind of long. There's like 4 years, and then you have to do an extra year or 2 if you want to do a fellowship. But all in all, I'll say this was a pretty good experience. I learned a lot, especially from my attending physicians. They were really helpful. And yeah, so that's it for this week's vlog. I got some vlogs coming for you guys. I start surgery next week, and so I gotta see what the hours are gonna be, what kind of time I'm gonna be getting. Hopefully I'll be able to do as many vlogs as possible and keep you guys updated. So that's it. If you have any questions, any comments, or any content that you want uploaded, make sure you drop it down below in the comment box.